In this episode of TAC Tic Talk, Jaclyn and I caught up with Dr. George Roth. Dr. Roth is a doctor of chiropractic as well as a naturopathic doctor and recognized as an authority and pioneer in the field of physical medicine. He is the developer of Matrix Repatterning, a breakthrough treatment system that is recognized worldwide. He's also the author of the Matrix Repatterning program for pain relief, and his contribution to the treatment of concussion and traumatic brain injury has been acknowledged by Dr. Norman Doidge in his best-selling book, The Brain's Way of Healing. Listen on to hear what Dr. Roth had to say.
Welcome to TAC Tic Talk, right? That's
that's wild.
The big opening. Dr. George Roth, our TAC Tic Talk, TAC's TikTok program. Dr. Joe Busch, our editor, of course, the publisher, Jaclyn Touzard. We are siblings. And Dr. George Roth, you've been such an amazing contributor with the American Chiropractor magazine for years. Today, we're happy to have you on the program so that we can discuss, of course, your latest article in our December 2022 issue about unstable joints. Of course, that's not going to limit the conversation, but we did want to open it up a little bit. That was the purpose for getting you on the call today. So I wanted to say, good to see you, actually, and to hear you for all of our listeners on the podcast. How are you doing today?
Thank you very much. I'm doing well. Been teaching back-to-back seminars recently. We've had some amazing practitioners from all over the world. We have a lot of chiropractors throughout North America. We have practitioners from Europe now, New Zealand. So yeah, it's a cross-section of practitioners, medical doctors, physical therapists, occupational therapists, veterinarians. So it seems to be bridging the gap in a lot of different people's thinking about how to look at the body. I know the chiropractors who have been working with us are pretty excited. And so I wanted to share some of that with your listeners and with you guys. So I'm here and open to your direction. The main focus here for me is helping people look at the body. For me, many years ago as a chiropractor, I graduated, shockingly, 45 years ago from the Canadian Memorial Chiropractic College. Early on, I realized that there were a lot of things that excited me about chiropractic, the model, everything else about it, which is what drew me to it. And then I realized there were things that kept on showing up that just repeatedly needed treatment the same way over and over again. And I kind of got a little frustrated and thought, okay, maybe there are some pieces here that we should look at that might be anyway. So pieces of the puzzle that were perhaps missing, that if we could address those, then we'd have better tools. And so one of the things that stuck with me after I was at the chiropractic school, I was actually teaching dissection as an anatomy assistant and looking at cadavers and looking at x-rays during my student years. Noticed that there were significant differences in bone size from side to side. For example, one side would have an enlarged tibial plateau or femoral condyle or acetabulum, femoral head, and noticed that there were differences. Started asking questions, why are these differences here? And realized that really no one had an answer. And then started looking at other approaches, started studying osteopathic medicine, worked at and studied at an osteopathic hospital in Ohio for a number of years, studied with French osteopaths. And there were some people who were looking at bone itself. And I started to realize that this is actually a plastic fascial structure that we could influence. And so some of the things that we are often looking at as chiropractors, I feel, are sometimes mislabeled as subluxations, rotations, translations, and so on, when in fact, when I started looking at them this way, I thought, well, maybe they're actually enlargements of certain parts of that structure. And lo and behold, when I started looking at it closely, this actually seemed to be the case. So, for example, in some of my articles, I talk about how if you look closely, for example, I have a model of an atlas here. If you look closely at that, it's hard to see on this camera, but in fact, on one side versus the other, there's quite a difference in the size of the condyle here. And even if you look at it, you look at the same one, the enlarged one here, you can see the height is different. It's actually about a 2 millimeter difference in height, which could easily be mistaken for a subluxation. And if you look at the gap here on the larger one on this side, the distance from front to back compared to this side is different, right?
Mm-hmm.
It's actually a
Right.
difference in the bone. And
Mm-hmm.
started noticing that, when I looked at really good skeletons, I had a real one at one time, and some of the models of skeletons which are cast from a real one, you can see this throughout the spine. So here's another example here. You may be able to see the differences here, the height on this side versus this side. Okay, there's a difference in the height on one side of the lumbar spine. You can see the corresponding expansion of the articular process. Okay, on the same side as the lumbar body. So it's quite a big difference. And so these are the kinds of things that we could easily mistake for a malpositioning of the vertebra. But the idea that this is something that you keep adjusting. I said, well, wait a sec. If it's actually an enlarged bone, and now we have evidence, by the way, my observation 45 years ago was verified by a researcher, Dr. Paul Hansma at the University of California in 2005. They actually used a very powerful microscope, believe it or not, called a atomic power microscope. It sounds like something out of science fiction. And they were able to look inside bone while injury was applied to it and saw the protein structures expanding dramatically. And then after the injury, it came back, but it did not go back to the original size. So verified that. And I've spoken to Dr. Hansma over the years, and he actually allows me to use his illustrations because he said no one else is looking at this and looking at the potential clinical implications. So it's quite huge. And so that's been my journey for many years now, is looking, A, can we identify these injuries, and B, can we correct them? And maybe there are ways, and I have slides available too. You can see these differences, and actually pre and post treatment, we can measure the bone size. We've had the great opportunity to see this on X-ray. We've actually been able to verify it in several cases. And so we know we can actually influence that. And it's surprisingly gentle and easy approach once you learn it. And I think chiropractors who are doing this work are realizing they don't need a lot of force. It's really just a question of accurately and precisely targeting these changes.
Very interesting. Very interesting. Dr. Roth, absolutely. The human body's full of asymmetries, and that's going to influence even the dynamic motion component of it. Just leg length inequalities. I think 80% have up to 1 centimeter. I've seen statistics that demonstrate that, another 10% even greater. So what you're recommending is that one works with the soft tissues through more gentle approaches. Is that an accurate description?
Actually, not quite, because we actually treat bone directly. And what's interesting is we've all learned Wolff's Law. We know that, over time, mechanical stresses influence bone growth. But this is a nonlinear, we'll call it nonlinear, instantaneous change. And I actually had the evidence of this once. I was skiing and I fell, and I instantly had an enlarged first metacarpal on my thumb. Okay. And so what we have found, though, is that this can almost be instantaneously reversed. It's an actual molecular change in bone. And it actually changes not only the cell structure, it changes the electrical properties. And we actually can detect these by electrical changes. And we now know that bone actually changes its electrical properties with injury. So fractures have been known for a long time. This is why bone stimulators for non-union fractures were developed. But these changes are quite dramatic, and they actually, within even 1 or 2 sessions, we can reverse that bone size expansion. So it's not Wolff's Law. It's a separate molecular response to injury, which they actually observed at the University of California. It was an instantaneous change, not Wolff's Law. Okay.
I just want to jump in and say this is amazing to me about the repercussions and ramifications this could have then. Now, has this always been your technique? I remember, like Dr. Joe said, I always remembered when I first heard about it years ago when he first started writing with us and thinking about it in relation to the soft tissues, because I remember, you explaining about the whole, network kind of in the body, how an injury and how it has all these different communication networks.
Extracellular matrix, right?
Absolutely. I can share one slide with you, if I may, which illustrates how they interconnect. Okay, is that okay with you?
Yeah, but I was going to say, because this is the first time I hear you specifically talking a lot about, the bones, because I remember you talking about even about water and whiplash patient, very low even, and how the heart is made up of so much water that wherever there's water, there can be a huge ramification to something that you might not even think twice about.
Absolutely. And that's where it gets translated. So when you have these mechanical changes in these tissues in bone or the fascia around the heart, for example, with impact, that mechanically is transferred through what I call the extracellular matrix into other areas. And that's what creates the fascial changes there. But tracing them back to those local areas, what we call a primary restriction, which actually is in the more dense material. So water is very dense, for example. People in a car accident, they have internal injuries. Literally, the heart and liver, for example, can rupture. The spleen ruptures very often. It's very thin walled. So these forces, like a water balloon, the idea that you've got this geodesic framework in the fascia, and it's actually, we now know this is the nature of the cell. The cell structure itself has this protein, the cytoskeleton framework. And if you look at a fluid-filled area, that translates into force like a water balloon. When you have an impact, that the water inside the fluid expands outward and becomes enlarged. That's transferred into the trunk, into the spine, into the rib cage. Case of a concussion, transfers into the bone structure. We actually see these changes in the skull, for example, as well as the spine and the ribs and the pelvis. Any of you, if you're listening to this, you easily just check your knees, for example. And if you look at the size of your knees, just compare the size of the femoral epicondyles, you'll see that one side is often bigger than the other. How many people haven't fallen on their knees at one point in their life, right? But then you'll see that the quadriceps or the hamstrings or the IT band on that side is under more tension. It's now, imagine, you're taking a structure that's surrounded by fascia and you expand the inside element. That's going to cause the fascia around it to become tighter, right? In order to release that fascia, you have to go deep into that structure, release that core restriction. And that's in the bone, very commonly in the bone. 90% of the time, it's transferred from the organs to the bone, and then that changes it as well. So that's why we know, the evidence for us, at least clinically, is we can make these changes and restore not only normal tone, fascial tone, myofascial tone, and joint movement in the vertebrae, for example, very quickly, but we can also restore stability, which is another whole area that's fascinating to me. And that happened by accident. Well, by accident, yeah, I guess a fellow came to me, a young fellow, 24 years old, with low back problems, and I said, okay, let's check it out. And he was scheduled for knee surgery for an ACL tear. And I said, great, well, that's fine. Let me just check that just for fun. I did a drawer test on his knee. It's like, okay, I could practically go across the room with his tibia, right? So this was a very unstable knee in the anterior drawer test. Okay, very good. So then I said, okay, that's fine. So I went ahead and I treated his low back. And what I normally do is normalize the structure of the pelvis, the ilium, the sacrum, actually change the bone structure, right? Which is what we do routinely, which is, I know, shocking to many people who haven't done it. But I went ahead just for fun. I just, wanted to double check, and I rechecked his knee stability, and it was solid right away. And I said, what did I do? I have no idea. So I just left it at that. He came back a week or two later and said, oh, by the way, my low back is great. And I went for my pre-op examination with the orthopedic surgeon, and he tested, checking these neuromuscular supports for stability. I realized this instantaneous change in his stability had to be something more responsive, and that's neuromuscular. And I started looking at things like the medial hamstrings, the popliteus in the case of the knee, and noticed the tone was instantly restored when I corrected certain areas in the pelvis or thoracolumbar spine. Same thing with popliteus, which is another stabilizer for posterior stability. Often mislabeled as a posterior cruciate problem. And then we looked at other things like the hip and the shoulder, supraspinatus, the gluteus medius, and so on. What was fascinating to me, though, was the lumbar spine. Okay. Because I knew many people walking around were actually suffering from an unstable low back. And when I went ahead and tested the paraspinal muscles in the lower lumbar spine, I was amazed how hypotonic they were, okay, relative to the paraspinal muscles higher up. And I thought to myself, why would the body allow instability to occur there? And this is where we see the degenerative changes, right? Well, when you look at the physiology, why does the body create instability? I believe that one of the reasons is the body is actually trying to protect vital structures. Well, what's the most vital structure in the body? The nervous system, the spine, the cranium, okay? But this the spinal cord, okay? The spinal cord is the key. Well, the spinal cord ends at about L2 or 3. The lower lumbar spine from L3 down to L5 is actually cauda equina. It is much less vulnerable to these changes. And so I postulated that the body, if it detects an injury that's threatening to the spinal cord, is going to start shutting down these stabilizers to reduce the amount of stress coming in to potentially damage the spinal cord, which is way more vulnerable. The spinal cord is damaged, it's game over, right?
Right.
But we can survive with painful low back or painful knees or shoulder. Yeah. And I make the joke we could probably escape a very slow predator, like a sloth or a porcupine, perhaps, or, a disabled lion. But, essentially, it's a survival thing. And I call these other joints that are turned off and become unstable, I call them sacrificial joints. The body will sacrifice those areas to protect vital structures. And that's my theory.
Yeah. Based on that, what kind of intervention are you doing when you're saying you're correcting the sacrum and the bone structure around the pelvis?
Correct. Yeah. So a lot of different things will help that. I mean, certain manipulations, adjustments will improve it. But what we found is we don't need to do anything vigorous. If we can identify those areas, we can actually use very targeted vectors and very gentle pressure. And we support that with some bioelectric stimulation because these changes are bioelectric. And so what we're creating, we believe, is a piezoelectric effect to restore that normal structure. And what's interesting, you talk about the long leg or the short leg. We see that, Dr. Busch, changing instantly. We have shocked practitioners in our program. We've had people reducing the size of a leg length discrepancy by over 5 to 10 centimeters in one treatment. It's insane. So things that I never would have thought possible, and people are experiencing that. So this is something until you experience it, it's a challenge. It's beyond belief, really. And then chiropractors, I trained. One chiropractor brought his wife in, and he'd been treating her C1's vertebra for years, right? And he detected that that thickening on the one side, which we do think is a subluxation. I went in and applied very gentle pressure, no force at all, and it got him to recheck it, and he was amazed. He couldn't believe it. Like the subluxation was gone, didn't require any forceful manipulation. And he called me a month or so later. He says he's never had to adjust it since. And many chiropractors have experienced that. And this is why we're excited, to share that, because it is something that we think could help chiropractors do things more effectively, more deliberately, and without, a lot of the risk, sometimes a forceful adjustment, if it's, we don't always know if there's a problem with the vertebral artery or whatever. This technique really takes a lot of that off the table. It does no force at all. And so, this is why many chiropractors using this now say that it's revolutionized their practice.
Wow. I want to jump in and ask then. Well, so first up, how long have you had this technique? And now, as I recall, it was Matrix Repatterning technique. Is that the name of it, Dr.
Matrix Repatterning, right?
And then, so I wanted to know, when exactly did you kind of formally, create it or launch it? And then how many doctors since then are on board? And are they all chiropractors, or are there other, I think you were mentioning too, maybe other types of doctors who are able to participate?
Yes, for sure. I've been teaching it in various forms over the past 30 years. Formally introduced the first seminar in 1992, so we're just celebrating our 30th anniversary. We started doing a more formal course about probably 2005. So we created a certification program, so it's much more formalized. And it's a big paradigm shift. So we have about 150 certified practitioners around the world, mostly North America. And we have mostly chiropractors. We have also a physical therapist, physiotherapists, we call them in Canada. We've had occupational therapists, medical doctors. We've had a few veterinarians involved. It's a very exciting animal experience. So some chiropractors who treat animals actually, two of the chiropractors who treat animals recently did that. We have to do a thesis as part of their training, and they both shot videos of these horses that they treated. One was incredibly lame. She showed the structural problem in the restriction in the near the foot, in the ankle area. She found an injury up in the shoulder, upper thoracic area, and she treated that. It instantly restored that horse. That horse was no longer lame, like literally right away, and continued to perform well after that. So identifying these problems, often not necessarily where the symptoms are, because of this fascial framework you talked about. This is called the biotensegrity matrix. So an area of tension in one area creates restriction and pain in other areas. So you can illustrate that really easily yourself. If you take a moment now and if anyone listening, just close your eyes for a minute, notice your neck and shoulder tension, right? And just go ahead now and then clench both your fists and notice your neck and shoulder tension, right? And then unclench them. Try that a couple of times, and you'll notice there's almost instantaneous increase in tension in your neck and shoulders. Did you notice that, Jaclyn, when you clenched your fist?
I didn't have any tension in my neck, but I'm trying to figure it out.
But just feel what happens when you clench your fists, though. Okay, feel your neck and shoulders. It's good with your eyes closed, and then unclench them. All right. Did you notice that, Dr. Busch?
So it sends the tension that was in my hand, sending it up to where I'm thinking.
That's like an injury. That's a source of tension far away from here. You can do the same thing by just plantar flexing your feet or dorsiflexing. You'll feel it up here. It travels through the body instantaneously. And so what that does, it tells you that maybe an injury in one place could affect your symptoms. That's been the big challenge. Where are things coming from? And what's interesting, when we actually test these areas, we use this bioelectric device that we created, and we can scan the area, and we place this specialized magnet, which is really a very powerful multi-orbit concentric magnet. It creates a little bit of a microcurrent. We used microcurrent devices before. And when we apply those, that's why they work. They work because it actually stimulates bioelectricity. And guess what? When you apply it the right way, it relaxes that area. Okay.
So, Dr. Roth, you're the first one to really talk about, using these types of microelectrical currents in order to affect. Whenever someone talks about like fascia, it's like a painful experience, So it sounds like your approach is a little bit different towards that. Is this the only device that you use to diagnose these impedance?
Yeah, well, yes, we also areas, we also look at the structure. We actually measure the bone size. Okay, we look at posture. We do all the orthopedic tests, ranges of motion, joint stability. All of those are clues as to what the problem is. But to find the source of the problem, this is our big clue. This device, you may be able to see it.
What is that called?
This is called the Matrix Mag scanner. So it's a device which we use also therapeutically. There's I'm going to turn off my blur here. I don't know.
Yeah, you got a blur there.
I'm blurry.
Now, bone size. Are you doing that on X-ray, or how are you doing that?
Yeah, you can see that's the home version here. The people use that at home. That's the professional version. On the scan, what did you say about that?
The bone size. How are you determining that? Are you doing
we use tape measures, tape externally, not X-rays, but we can use calipers. We can actually measure these fairly accurately. Not always, because you're still going through skin and fascia, but you can get a pretty good relative idea. And then remeasuring, the length of the tibia, looking at tibial plateau height and so on. And practitioners, there's substantial differences. And quite often these are measurable changes with even 1 or 2 treatments. Yeah.
Well, that's cool, man. This is definitely something that, in order to take your game to the next level, especially being a low kind of force approach like you're describing, is very appealing to, broad swath of the population. And measurable changes right away is something that any chiropractor wants to be able to have in their armamentarium, right?
This is my question too, then. I mean, how long does it take for a doctor to learn this? It sounds like, it's amazing to me. I'm surprised there's not more doctors on board. What do you find as a reason that they're not jumping on board as fast? Is it time consuming? Is it super expensive?
So the process of learning is basically now it's almost entirely online. It's all entirely online the last 2.5 years.
Right.
We were already 70% online prior to COVID. We quickly, because we have a huge video library, practitioners have access to our video library, step-by-step instructions for each part of the body. They can do the whole program in roughly 6 to 8 months. It's over a period of time. We have a number of live webinars in there. They have coaches that support their learning. And then we do have live events again starting next year to support, their process. We literally have gentle pressure that's used. We actually have devices that will measure the exact amount of pressure needed. So we have what's called a containment gauge. We use something called containment to actually apply the technique. So then as far as why other doctors haven't adopted it, it's a big paradigm shift. And it does take a little bit of time. There's a learning curve like anything else.
Right.
But the doctors who've adopted it are finding, yes, maybe they take a little time and assessment. But the key is they can show the changes because they can apply the Matrix Mag scanner to an area and instantly change the muscle tone, instantly improve the stability or range of motion. It's quite dramatic and shocking. So they can onboard patients. They can really educate them by demonstrating that instantly. So there's no need to explain it. Like why my low back, for example, looking at the teeth, that was a shocker. I had a dentist years ago, came in, he lost the use of his left arm. I said, what the heck's going on? He had like a thoracic outlet thing. I couldn't find where it was coming from. I said, did you do anything different? He said, well, yeah, last week I went to a colleague, I had a tooth pulled. I said, oh, well, that's interesting. So I put the scanner over his tooth and instantly this all released. And then I released the tooth socket. So we actually have dentists now, orthodontists, who I teach a separate course for, and they can literally restore the bite. They can help reduce inflammation and irritation after a restoration or extraction or implant. And they're excited. They're so excited to be able to do that because their outcomes are significant. So as far as the chiropractors, chiropractors are often, time driven. They say, oh, I got to get this many treatments in. But the point is, it's if you're not getting the results and you want to learn something that's going to take you beyond that, we tell them, pick a couple of problem cases. Let's start with that. Give that a little more time to practice and search for these things. Yeah, and you can do some good work in 5-10 minutes or 15, but a lot of other practitioners are doing longer sessions and they're finding it exciting, and then they can charge accordingly because they're getting results. Our focus is solutions, right? So people are going to pay for solutions, rather than treatments, I'll tell you. And there's a natural referral base. People don't even advertise, the ones who are doing this now. They find that people are looking for results. And if the economics of the time, in my opinion, dictate that we have to provide better solutions because people's coverage for, extra care and a bunch of treatments are limited now. But if they can get results within 2 or 3 or 4 sessions and actually change their trajectory of their health, they'll pay, believe me, they'll pay, what it takes. And so many of the chiropractors and other practitioners, as I say, who are doing this now, find there's very little difficulty in convincing patients because they can demonstrate those outcomes really, really quickly.
That's amazing to me. I mean, and you're talking my lingo when you talk about the dentist stuff, because as a woman, they always say for every child a woman has, they lose a dentist. I mean, they lose a tooth. I mean, that's what they've told me walking around to these trade shows for years. I've got 3 children, and as I get older, I'm like, oh my gosh, I've been holding onto my teeth, but they're trying to get them.
Yeah, for sure. And bone density, bone integrity is really crucial in that. a lot of these things, if they've had facial trauma or dental trauma, it changes the local circulation to the jaw, and that can influence the retention of teeth as well, And
oh my goodness. I'm so excited to hear about all this because it sounds to me pretty miraculous, quite frankly. And I understand, I think, what you're going through because my question would be, now it sounds like it takes more time for the doctors with the patients. Now, the patients overall, though, is their time at the doc. It doesn't sound like it's that big of a deal versus a regular doctor's appointment. So it's just a matter of the change in the doctors knowing how to package it, charge for it appropriately.
Yeah.
And then from there, then I think that, like you said, the rest takes care of itself.
Sure.
To me, it sounds like, yeah.
Sure. And with time, they'll become more efficient. But there's, like I say, a learning curve. It
Right.
might take longer initially to incorporate these things. And we had a huge meeting of about 100 practitioners just over the past weekend. And, people were saying it's worth taking the extra time because they get people literally understanding what you're doing, why you're doing it, and they will adopt the treatment plan with no questions asked because they can see, we can literally demonstrate the improvement before treatment. By applying the normalizing field, you change the tone, you change the stability, you improve ranges of motion instantly. Like it's quite shocking. And when you say it's a kind of like, it seems like a miracle, but it's because the miracle of the body. This is innate in action. This is the way the body is designed, but we just didn't know how to speak the language and look deeper. I talk about looking deeper. Look at these dense structures that we've been missing and realize that bone is extremely plastic. You can actually take a living tibia fresh out of a cadaver and bend it by 30 degrees. People think, bone is this rigid thing. It's not at all. It's an amazing shock absorber when it's fun and it's healthy. But when it's injured, it literally, the structure expands and becomes rigid at the molecular, at the cellular level within the cytoskeleton. And that's something that other researchers I've worked with in Harvard and at Michigan State University, they've been looking at for years, but did not know how to apply it clinically, right? So this is more and more evidence that what we're doing is congruent with the molecular structure and the cellular structure of the body. I think
very interesting stuff.
I wanted to ask one more thing on this subject. Sure. Sorry, Dr. Joe, because before I forget it, but because it sounds to me like you're saying that if somebody has, because we have a great story where my father, who is a chiropractor, and my oldest brother, Dr. Rick Busch III now, who is a chiropractor, where he hit his fist into the wall. And then and then this is a great story, but my father had learned a chiropractor taught him, and he basically was able to apply enough pressure so that, and my brother was screaming out, crying, but he had like a wrestling match the next day. But so what my father was doing was applying so much pressure to the point of pain where he couldn't even register it anymore. And then right after that, the next day his hands were fine. He was able to wrestle in the match.
Yeah, so that's very, very, that fits in exactly what we're saying. We sort of know this intuitively, putting pressure on an area, which is actually what we call containment. And if it's done very specifically, you can actually reverse much of the injury. What your father may not have realized, or your brother, when that impact happened, it went right up into the forearm, up into the humerus, up into the shoulder, into the neck. And if you trace all of those injuries back, everything interconnects. And these areas that when you fall on your knee, it goes up through the femur, into the hip, into the low back, into the TL spine. It can often, even severe enough, cause a concussion because it goes up through the spine, through the neck, into the cranial base. So there's so many. And chiropractors, when they talk about the nervous system, they're forgetting a huge component. This is an area, by the way, Norman Doidge is a researcher in concussions who wrote about my work in 2016 in his new book called The Brain's Way of Healing. He said the number one thing that should be done after an injury to the head is get matrix repatterning, because he actually tracked this. He interviewed patients and he actually took the program. And we realized when we look at the structure of the head, you can see the same changes in the cranium. You can see this expansion of the occipital condyle here, the prominence here. This corresponds exactly with the enlargement of the C1 articular process. And that totally changes the mechanics and stresses on neurons, on blood vessels. So this is why people come to see us from all over the world for concussions now, because it's a best-selling book, The Brain's Way of Healing by Norman Doidge, who also wrote a book called The Brain That Changes Itself back in 2007. So this is, this is a big area that I think chiropractors should look at, because when you look at the nervous system and you're not talking about from the occiput up, you really should start considering that. And it's a big, and a lot of neurological chiropractors. I'm at my son-in-law's office right now, who's a neurological chiropractor, and brilliant neurological investigation. And we have neurological chiropractors doing our work now, and they're excited because they're not only able to measure precisely, they can see the outcomes almost instantly. And these are great tools, but without getting the appropriate treatment, they're just trying to use neuroplastic techniques and retraining, but it only goes so far, right? And the patients still hit a plateau and they can't get past it until we literally correct and change the shape of the head. We've had facial trauma where we've changed the shape of the face, and the things like the facial recognition software doesn't work anymore. It literally changes it.
Well, that's what I was going to say. So this means to me, because I think the bones were always something that it was just like you're always resetting it, and it had, you had some time. But to hear you talk about it, sounds like everything's off the table now. Like basically any kind of bone issue could be much faster healed than we have been.
As you correct the bone, the joint takes care of itself. In most cases, you restore the bone structure. You restore stability. The joint lines up beautifully. And chiropractors find they need to do very little adjusting. It's easy, and it stays. Once they correct these other issues, the adjustment lasts. Okay.
Can I ask one last thing too? I'm not sure. Would scoliosis have any kind of impact with this?
Yeah, for sure. Scoliosis is an interesting phenomenon, and there are people who are susceptible to that distortion. We believe it might even start prior to birth, the umbilical torsion and the neural tube torsion. If the fetus is spinning excessively in the womb, we see that happening. Then later in life, around adolescence, they can become more active and they have injuries and falls. That distortion, that spiral strain starts to magnify. So, but we have some techniques we've found that are very useful in not only restoring the structure, but getting rid of some of that torsional strain. So that's something we believe we've helped in quite a few cases. And the earlier we get to it, the better. We treat infants. We normalize that spiral torsional pattern. They have improved digestion, improved bowel function almost immediately. We see spinal curvatures improving very quickly. And so we believe in the long term, we could actually prevent some of these changes.
Wow, very good. Well, I was going to say, so right now, though, it's only the way they're learning through it is through your institute, right? And do you guys have any affiliations yet with any schools?
Yes, we've taught this through Logan College in St. Louis. We taught it through the Canadian Chiropractic School in Toronto. Because we allowed other practitioners, I believe, to come in. They said, well, we just want this exclusive for chiropractors. But, I'll tell you, there's great dialogue with chiropractors and other practitioners. It's a wonderful opportunity for cross-pollination and new ideas. So I love the fact that we have a whole range of practitioners doing this and interconnecting and referring to each other. To me, that's a wonderful thing. So right now it's just the Matrix Institute. MatrixRepatterning.com is our website. And we do have the matrixinstitute.net is the professional site where they can learn about the programs. But either way, whatever. There's lots of videos showing how we do it, what we do. So there's lots of things people can learn right from the get-go on our video platform.
Well, let me see. Dr. Joe, I didn't mean to cut you off there earlier. Just really excited about this subject matter.
Right. No, I find it very interesting. And thank you for your time, Dr. Roth. I know that we kind of snuck in there for this Monday.
My pleasure. And I thank you for taking the time. And I'm always glad to share. It's exciting.
Well, thank you very much. And please go ahead.
It's just really exciting for me because I see the practitioners who are doing this. They're so passionate about it because I have chiropractors saying, even if their license was taken away, they would want to do this for the rest of their lives. We have chiropractors in their 70s and 80s learning this. People I went to school with who were my instructors at chiropractic school are now doing this. And they're so excited because they know they can do this well into their later years with no stress on their body. Patients love it because it's so gentle as well. So, there's no fear and no risk in to the technique at all.
That's a great point, because I've seen now, there's a lot of women chiropractors. I have my own children. I'm thinking about whether I would want to encourage them. And I always feel like chiropractic, the hands-on adjusting is such a strong, you have to, it feels like you'd have to be a man to do it. But when I hear, about techniques like this, where you can actually be doing a lot with very little, force, it makes me feel that much more reassured. This is definitely,
we like working. Yeah, we're working with the body. The body seems to accommodate this really easily. And, that's why we find that actually using too much force is counterproductive. So the body will resist that. Whereas if you come in and you gently coax the tissue back to normal, it just responds really, really quickly.
Wow, that's amazing.
It's a lot of fun. It's a lot of fun seeing people get on with their lives. Yeah.
Well, Doctor,
very good. So look for this article in the December issue of the American Chiropractor. The December issue always features technique, which we're always grateful to have your inclusion in editorial, and where you share your experiences that you've been seeing with this Matrix Repatterning technique. So look for it either online or in your mailbox in December.
Great. All right. Well, thank you so much.
Thank you, Dr. Roth. We'll welcome you to contribute any kind of shorter blurbs throughout the year too. So it's not just once a year. We get to hear about your fabulous work there. Okay. So I'll have my team reaching out to see what we can do to help keep you connected a little bit better.
Great, guys. Thank you so much.
Thanks, Doc.
Hey, thank you so much.